Nanomedicine for Diabetes Management Narrator. Welcome, students, to today's lecture on the exciting field of medical nanotechnology. In this lecture, we will explore the role of nanotechnology in the management of diabetes. Diabetes is a complex metabolic disorder characterized by high blood sugar levels. With the growing prevalence of diabetes worldwide, there is a pressing need for innovative solutions to improve patient outcomes. Nanotechnology, with its ability to manipulate matter at the nanoscale, offers promising avenues for revolutionizing diabetes management. Let's delve into the fascinating world of nanomedicine for diabetes together. Narrator: Nanotechnology involves engineering and manipulating materials at the atomic and molecular level, typically in the range of 1 to 100 nanometers. This scale grants scientists incredible control over the fundamental properties of materials, leading to breakthroughs in various fields, including medicine. In the context of diabetes management, nanotechnology offers several advantages. It enables precise drug delivery to targeted tissues, enhances sensitive monitoring of blood glucose levels, promotes tissue regeneration, and facilitates non-invasive diagnostics, among other applications. Narrator: Continuous glucose monitoring is crucial for individuals with diabetes to maintain optimal blood sugar control. Nanosensors, which consist of tiny devices with sensing capabilities, have revolutionized glucose monitoring. These sensors, typically coated with glucose-sensitive molecules, can detect variations in blood glucose levels and transmit real-time data to wearable devices or smartphones. Nanosensors provide an accurate, minimally invasive alternative to traditional methods such as finger prick testing, enabling frequent monitoring and timely intervention for improved diabetes management. Narrator: Traditional diabetes treatment often involves systemic drug administration, leading to nonspecific drug distribution and potential side effects. Nanoparticles, with their unique properties, offer a promising solution for targeted drug delivery. These tiny particles can encapsulate drug molecules and navigate the complex physiology of the human body to specifically target affected tissues. By delivering therapeutics directly to the site of action, nanoparticles increase drug efficacy and reduce systemic side effects. Nanoparticle-based drug delivery systems hold great potential for enhancing insulin administration and improving patient compliance. Narrator: Artificial pancreas systems aim to mimic the functionality of the pancreas, which produces and regulates insulin in the body. Nanotechnology plays a pivotal role in advancing these systems, integrating glucose sensors, insulin delivery devices, and control algorithms. Nanomaterials, such as graphene and carbon nanotubes, offer advantages for developing high-performing glucose sensors. Moreover, nanotechnology enables the precise encapsulation and release of insulin, enhancing the closed-loop control of blood glucose levels. Artificial pancreas systems represent a breakthrough in diabetes management, promising more precise blood sugar regulation and improving patients' quality of life. Narrator: Islet cell transplantation holds immense potential for curing type 1 diabetes by replacing the damaged or dysfunctional insulin-producing cells in the pancreas. However, the success of this procedure is hindered by challenges such as immune rejection and limited availability of donor cells. Nanotechnology provides innovative solutions to overcome these obstacles. Nanomaterials can be engineered to encapsulate islet cells, protecting them from immune attack. Additionally, nanotechnology facilitates the regeneration of islet cells, offering hope for both type 1 and type 2 diabetes treatments. Narrator: Diabetic patients often struggle with impaired wound healing, leading to chronic wounds and an increased risk of infections and amputations. Nanomaterials, specifically designed for wound healing applications, offer unique properties for addressing these challenges. Nanofibers can be utilized as scaffolds to guide tissue regeneration, while nanoscale drug delivery systems can promote wound closure and protect against bacterial infections. Moreover, nanotechnological approaches enhance the release of growth factors and cytokines, accelerating the healing process. These advancements in wound healing hold great promise for diabetic patients and can significantly reduce healthcare costs. Narrator: Non-invasive glucose monitoring is a holy grail in diabetes management, eliminating the need for painful finger prick tests. Nanotechnology has paved the way for innovative non-invasive glucose monitoring techniques. For instance, nanomaterial-based biosensors can detect glucose levels in sweat, tears, or saliva. Additionally, nanotechnology enables the development of smart contact lenses capable of monitoring glucose levels in tears continuously. These breakthroughs in non-invasive glucose monitoring will significantly enhance the convenience and quality of life for diabetes patients. Narrator: Nanorobots, often referred to as nanobots, are tiny machines designed to perform specific tasks at the nanoscale. In diabetes management, nanorobots hold immense potential for insulin delivery. These miniature robots can navigate the bloodstream, target pancreatic cells, and release insulin in response to real-time glucose levels. By mimicking the natural insulin secretion process, nanorobots provide an automated and precise method of insulin administration, reducing the burden on patients and promoting optimal blood sugar control. Narrator: beta cells, the insulin-producing cells in the pancreas, are often impaired or destroyed in diabetes. Restoring or regenerating these cells represents a promising avenue for diabetes management. Nanotechnology offers innovative approaches for beta cell regeneration. By utilizing nanomaterials, researchers can create three-dimensional scaffolds to support the growth and differentiation of stem cells into fully functional beta cells. This advanced tissue engineering technique holds great potential for developing robust and long-lasting solutions to restore insulin production in diabetic individuals. Narrator: accurate diagnosis and monitoring of diabetic complications are essential for timely interventions. Bioimaging techniques, enhanced by nanotechnology, provide detailed insights into diabetic pathologies. Nanoparticles can serve as contrast agents, enhancing the visibility of tissues and enabling precise imaging of organs affected by diabetes. These techniques, such as magnetic resonance imaging, MRI, and fluorescence imaging, assist clinicians in early detection, monitoring disease progression, and evaluating therapeutic efficacy. Narrator: diabetic neuropathy, a common complication of diabetes, affects the peripheral nerves, leading to pain, numbness, and impaired sensation. Nanotechnology accelerates advancements in diabetic neuropathy treatment. Drug-loaded nanoparticles can specifically target damaged nerves, delivering therapeutic agents and promoting nerve regeneration. Additionally, nanomaterial-based neuroprosthetics offer a potential solution for restoring sensory function in affected individuals. The integration of nanotechnology and diabetic neuropathy treatment offers hope for improving patients' quality of life and reducing the burden of this debilitating complication. Narrator: as with any emerging field, nanomedicine for diabetes management raises important regulatory and ethical considerations. The development and implementation of nanotechnology-based treatments require stringent safety and efficacy assessments. Regulatory bodies play a crucial role in ensuring the quality, effectiveness, and ethical implications of these novel interventions. Balancing accessibility, affordability, and patient rights is essential for the ethical advancement of nanomedicine in diabetes management. Collaborative efforts between policymakers, researchers, and healthcare providers are pivotal in navigating these complex considerations. Narrator: in conclusion, medical nanotechnology opens up unprecedented opportunities for revolutionizing diabetes management. From continuous glucose monitoring to targeted drug delivery, tissue regeneration, and non-invasive diagnostics, nanotechnology offers remarkable advancements in all aspects of diabetes care. However, achieving the full potential of nanomedicine for diabetes requires addressing regulatory and ethical considerations. By fostering interdisciplinary collaborations and prioritizing patient-focused innovation, we can improve outcomes and enhance the lives of millions living with diabetes. Thank you for joining me in this enlightening journey through the world of nanomedicine for diabetes management.